Good day all. Hello, my name is Simon Brazier, your health renegade. I hope you all had a wonderful weekend. I've got about one more month left of this semester, then I'm going to head back to England for a little bit of Christmas family friend time, which I'm really looking forward to. To my fellow Pacific Rim students, I wanted to say good luck, keep up good work. The semester's nearly done. Today, I'd love to talk to you about cardiovascular disease, and along with that, five of the most well researched therapeutic substances, five of the most problematic substances, and four of the best therapeutic actions that you can take. Cardiovascular disease is the number one cause of death globally, so it's a massive deal. So, what is it? Cardio refers to the heart, and vascular is referring to vessels. And from this image, you can see the high amounts of vessels that are coming into the heart and that are moving away from it. Coronary heart disease is the most common form of heart disease. Coronary meaning crown, and it refers to the arteries that surround the heart, kind of like a crown. They supply the blood to the heart muscle, and coronary heart disease occurs when there's a buildup of plaque inside the arterial wall. Over time, this buildup of plaque may partially block the artery and slow down the blood flow to the heart. A heart attack occurs when the plaque ruptures and forms a clot in the artery, causing a complete blockage. The part of the heart muscle that is denied blood supply basically begins to die. Heart attack. Classic signs and symptoms of coronary heart disease may include chest pain, shortness of breath, sweating, nausea, and having an irregular heartbeat. That's all obviously really crappy and sucks. So here are five of the most well-researched therapeutic substances. Number one is going to be vitamin D. So low vitamin D levels are associated with arterial heart disease. And as vitamin D levels increase, the presence of high-risk artery plaque decreases. The good cholesterol, HDL, has been shown to have a massive role in the prevention of cardiovascular diseases and atherosclerosis. Vitamin D supplements seem to have a really positive impact on blood HDL levels, which are key to reducing cardiovascular disease risk in the long term. Number two is going to be omega-3. So most literature on the subject suggests that the risk of death is reduced in patients with a higher fish intake and those with higher blood levels of omega-3 fatty acids. Omega-3s improve the cardiovascular risk profile of people with weight issues, high blood pressure, and higher markers for inflammation. Also, omega-3 supplementation reduces the total death and sudden death in people who have already had a heart attack. Food options for omega-3s include walnuts, mackerel, chia, and flax seeds, and also salmon. Number three is going to be coenzyme Q10. So supplementation of coenzyme Q10 is shown to reduce cardiovascular death and the inflammation responses within elderly people. Also, coenzyme Q10 supplementation may be useful as an option for the effective management of patients with potential heart failure. Number four is going to be nuts. So new information suggests that the pairing of tree nuts and dried fruit is a great way to reduce cardiovascular risk factors. The consumption of nuts should be encouraged in order to help maintain a normal blood fat level and to reduce the risk of heart disease. Higher nut consumption may reduce the risk of coronary heart disease and was independently associated with a decreased risk of overall vascular disease. Number five is going to be flavonoids. So flavonoids are a large family of plant pigments. This nutrient group is most famous for its antioxidant and anti-inflammatory health benefits. Higher intakes of fruit-based flavonoids have been associated with a lower risk of heart disease and heart attack within men particularly. Also, consumption of higher flavonol dark chocolate shows very modest improvements in cardiovascular function. The top five most researched problem substances are non-steroidal anti-inflammatories, so NSAIDs, aspirin, statin drugs, Avandia, which is a anti-diabetic drug, and finally ibuprofen. So perhaps, maybe opening a conversation, opening some dialogue with the prescriber of these drugs is potentially like a really good idea, really good conversation to have. The top four most researched therapeutic actions are dietary modification, looking towards more of a Mediterranean style diet, yoga, more of the relaxed versions rather than the sweat your ass off mental kind of versions, exercise, and also sunlight. There you have it. Cardiovascular disease is known as the silent killer. So pass on this information to your loved ones, and if you want any more information, please feel free to contact me. Have a wonderful day, everyone. My name is Simon Brazier. Goodbye.